Watch this.
When that bill made its way through and then ultimately got vetoed, I was disappointed in the veto.
Which is why that bill is back. At least a different version of it is. The quest to remove, quote, harmful materials from libraries returns for 2024. Something else that's different this session? How budget bills are debated in JFAC. Some of it will be behind closed doors.
This is a poisonous attack on our population.
Dr. Ryan Cole has learned his fate when it comes to practicing medicine in Washington. And since the State Medical Commission found him to be guilty of moral turpitude, you can bet it's not good. We'll explain that and his punishment.
We would love to engage more and try to find out what it is that they're really seeking. Are they really seeking us, to completely remove the books? If so, that goes against our mission.
That interview is from a story we did last legislative session when we wanted to give local library leaders a chance to give their thoughts on legislating their content. That was Mary DeWalt, the director of the Ada Community Library. She's questioning the real priorities of that proposed bill. Well, that bill failed, but they're back at it again with another bill that is supposed to give us a better idea of those priorities. Representative Jaron Crane pitched a reformed document in the State Affairs Committee this morning. He said it was born out of a compromise with Governor Brad Little. And if you recall last session, the harmful materials in libraries bill, was one signature and then one vote away from a law. The governor vetoed it, saying it contained unintended consequences, and the House failed to override that veto. Andrew Bartline was at the State House today to get the details on what's new for round two.
Early morning priorities. It's often based on what's in front of you. Confronting the snowfall today for where it otherwise shouldn't be.
They relocate it, the problem goes away.
Inside the State House, House State Affairs feels the same sentiment applies to Idaho libraries.
It had great support last time, and so we expect the same thing again.
Representative Jaron Crane pitched the bill.
Yeah.
State law already outlines harmful materials for minors. It includes nudity and sexual content.
If we gave that material to a kid on the street in downtown Boise, let's say, you would go to jail or have a $1,000 penalty. That is current Idaho law and statute.
But inside a library,
all of a sudden, that doesn't happen.
Crane considers the law inconsistent.
This material is bad outside this building and it's bad inside this building. It's for adults. That's not for children.
But he's now betting on a better outcome than last year's bill. It garnered mostly majority party support, save one in the state's highest office.
But I was disappointed in the veto, and he said, hey, it's not personal. There's a couple of things that I can't agree to and that we need to look at.
The governor's transmittal letter explains the bill's proposed $2,500 fine creates a bounty program where parents could hunt for misplaced library materials and scrape in checks off the back of taxpayers.
We added in a 30-day written relocation. So if you find a piece of material that you believe is harmful to minors and should not be in the kids section, you have to go to the front of the library, fill out a 30-day relocation notice. They have 30 days to move that piece of material to an adult section of the library. The problem goes away.
And if it doesn't, there's no free ride. Crane and Company conceded the original fine runs steep, especially for lower funded and rural libraries. But they still say some form of penalty is needed to maintain compliance.
We've brought it down to $250, so a substantial cut in what it was last year versus this year.
Like the snow, lawmakers say some materials are just where they shouldn't be.
We're not banning any books.
Explaining the majority party push to dictate what books get to go on which shelf.
All the things that we do, we try to craft legislation and policy that works towards temperance and morality.
The concern last year revolved around how the state currently defines sexual conduct. Homosexuality is considered sexual conduct by the definition of it in state statute, whereas heterosexuality is not listed. So opponents of last year's bill and sticking with this year's bill, assuming it does not rewrite the definitions in statute, well, the bill would again, according to people who oppose it, disproportionately target LGBTQ plus books. And I think personally, Brian, of something like Giovanni's Room by James Baldwin, where the main character is gay, that's homosexuality. Is that enough to get that book pushed out of maybe a YA section at a library?
Temperance and morality. Who determines what's harmful to minors when it comes to a book that has just homosexual characters in it.
According to the way current state statute is written, though, that would be enough. And so that's what opponents of the bill were concerned about.
All right. Well, we'll see what happens with this one this time. Thank you very much, Andrew. When your job is to discern and debate billions of dollars in a budget, it's best to not wait until the last minute, which is why JFAC, the Joint Finance Appropriations Committee, gets to work in the first week of the legislative session, usually. But where in previous sessions, with public input and testimony stretching some of those meetings to up to 3 hours, there's been a change this session to, well, not do that, to give lawmakers more time to actually work on the budget. Joe Parrish shows us the digital difference for 2024.
Look, government processes can be a little dull. We know this, but there is a push to make work for Idaho's crucial budgeting committee more simplified.
That's how I start these presentations I've been doing is who likes to sit for 3 hours when they first get to work and listen to PowerPoints, right?
Representative Wendy Horman is co-chair of the Joint Finance Appropriations Committee. That's the team tasked with crafting budgets for the rest of the lawmakers and the governor to approve. And those budgets now have a new, simplified process to go through.
We're really excited about these changes.
Chair Horman touched on the marathon 3-hour budget PowerPoint presentations that state agencies would present to JFAC, but in 2024, there's a new process.
Agencies will still submit PowerPoints, but they won't present them. What they will do instead is stand before the committee and respond to questions about their PowerPoint, any aspect of their budget.
So kind of like in school where you say, okay, everyone go home, do your homework, come back to school the next day and be ready for the assignment.
Members of the Joint Finance and Appropriation Committee are going to have to do their homework in advance of the committee this year. We think that's a good thing. And so, yes, that's a great analogy. Instead of a lecture model, much more interactive.
Lawmakers, lobbyists, and of course, members of the public can follow along with all of it online. The legislature has worked with the Idaho Controller's Office to create a web page that hosts the meetings, documents, and full presentations.
We will still be working 3 hours every morning, but only about 90 minutes of that will be spent in presentations and conversation.
The other portion of their time, JFAC members will work in smaller groups to analyze budgets and create ideas. The joint nature of the committee means the House and Senate work together, and their schedules often align very differently. The new workflow aims to help address that.
Every member of the legislature works on their bills on their own time. In the Joint Finance and Appropriation Committee, we need to work together. And so just accommodating a dedicated time in the morning for that work to happen is the goal here. It's legislators and our analysts only.
And every cent matters in budgeting, right? Just ask House Speaker Mike Moyle.
Heck yeah, it matters. If you don't think so, look at what's going on in your daily life. Everything we do here matters in your life.
Moyle sees the changes as a move in the right direction on several fronts.
I think it's great changes. I support them wholeheartedly. I think that getting those budgets started on the front end will help people see them, understand them better, and get us out of here earlier too. A lot of times we get at the end of the session and stuff's getting passed and thrown out some of those budgets that we don't understand. There hasn't been time to go through it. It's rushed. So I love what they're doing there.
A question coming into the session. Does the split of the 3-hour work session put work behind closed doors away from the public eye? Lawmakers say no. In fact, they believe new JFAC processes are more transparent than before.
One of the concerns with some of the press was that it was going to limit their stuff. I go, no, you're going to have more access now, and you're going to know the budgets better now, and you're not going to have to carry around a big book. It's all going to be more accessible.
No voting in private. We don't do that. No, but there will be conversation about what each informal group should recommend to the full committee. And then the full committee will make the decision in public.
So I'll tell you this, if you've never watched the Joint Finance and Appropriation Committee or even followed, or maybe you're not even familiar with the term, they do all the budgeting for the state of Idaho and all the budgets and all the things they go through. They used to be in these really thick binders, but Brian, as we highlighted in the story, everything's now going to be digital, and that's good for the people of Idaho who could access the actual data, but also the lawmakers who, instead of having to dig through an entire portfolio to find something, it's going to be a lot easier to do it digitally.
I understand there was a question of the press, but there's still no concern about open meetings issues, like hearing what somebody says about a certain line item or whatever might be of interest to some people.
Yeah, for sure, and there'll be people that maintain that opinion. I will say that lawmakers have told me as recently as today that the idea is to get the work done instead of having to sit there for 3 hours, listen, and then debate.
All right. Thanks, Joe. Mm-hmm. Dr. Ryan Cole's medical license in Washington has been restricted by the Washington Medical Commission because of his pattern of dishonesty and reckless disregard of the truth. Dr. Cole, the Garden City pathologist who rose to controversial fame during the pandemic for flouting COVID guidance recommendations like masks and the vaccine, and touting the use of the horse dewormer ivermectin to fight infection. More than 2 years ago, the Washington Medical Commission began investigating complaints against Dr. Cole, saying he was endangering lives for advising the public to not get the COVID vaccine and prescribing patients ivermectin, which is a parasitic medicine, to treat a viral infection. Dr. Cole had his hearing with Washington Medical Commission last fall.
Okay, what harm can you say that Dr. Cole did to others? Specific harm, please.
It's my understanding that he prescribed ivermectin and hydroxychloroquine, both of which were well proven to have no efficacy in the treatment or prevention of COVID.
Dr. Cole has been licensed to practice medicine in the state of Washington since 2007. It was because of that testimony you just heard, and several others, including from Dr. David Pate, the former CEO of St. Luke's Health System and a member of Idaho's COVID task force. The three-member panel decided last week Dr. Cole should not be able to practice medicine or prescribe medication in Washington for the next 5 years.
I started seeing endometrial cancers go up.
For the past several years,
This is a poisonous attack on our population.
Dr. Ryan Cole has traveled the world talking about COVID-19.
I don't even like calling it a vaccine. An investigational vaccine.
And the COVID vaccine.
A fake vaccine, okay. I can a clot shot, a needle rape, whatever you want to call it. Enter an effective prevention and treatment, ivermectin. 100% of the world trials have shown benefit.
Would it be your testimony under oath today that 100% of the world's ivermectin trials have shown benefit?
No. It's my testimony of the trials that I had reviewed at that time that were available in the ever-shifting and changing literature. That's what I had read to that point.
After that testimony, and after reviewing the complaints of several patients and doctors, the Washington Medical Commission concluded Dr. Cole engaged in multiple acts of dishonesty when he made numerous demonstrably false and/or misleading statements in public regarding the COVID-19 pandemic, COVID-19 vaccines, the use of ivermectin to treat COVID-19, and the effectiveness of masks. They even included a few of the false and misleading statements as proof, like ivermectin is a known antiviral medication, the COVID-19 vaccine has caused more deaths than the actual virus and has killed children, and the vaccine can cause cancer and infertility. Dr. Cole was also found to have prescribed ivermectin and other medications to several patients over a telehealth website without examining them or knowing their medical history. So the commission put Cole's Washington license on oversight and removed his ability to practice or prescribe medicine until 2029. His pathologist license remains intact.
Colin.
As usual, we tried to ask Dr. Cole about this decision.
Hi, you've reached Dr. Ryan Cole.
But our phone call, our text message, and our email went unanswered. Okay, so this decision comes with a $5,000 fine, and Dr. Cole has 30 days to appeal for a judicial review. Barring that, this decision also comes with a few caveats. His license on oversight means if he wants to have the restrictions lifted at the end of these 5 years, Dr. Cole must complete medical education courses on COVID-19 and other respiratory diseases, on record keeping and on telehealth within the next 6 months. He must complete an ethics program for healthcare professionals and he must meet in person regularly with the Washington Medical Commission. He also has to write a 1,000-word paper explaining what he's learned about professionalism, truthfulness, and honesty in medication. You may be wondering here, what does Idaho have to say about this? Because we do know that there were some complaints filed with the Idaho Board of Medicine. Well, we got this response today that under reciprocal discipline, the board may choose to adopt other jurisdictions' disciplinary order as its own, or it may impose its own order, and may elect to not impose a disciplinary order. We won't know what they do, but we do know a licensee must note any other prior discipline on an application for the issuance of a renewal of a license here in Idaho. So we'll see what happens, or we won't, with what happens in Idaho.
So we had a long, hard-working relationship, and really we didn't become friends until he got out. I love Chris. He called me his crazy uncle.
That was Boise State professor and co-director of the Idaho Innocence Project, Dr. Greg Hampikian, who was telling us about Christopher Tapp, the Idaho man he helped get out of prison 20 years after he was wrongfully convicted for rape and murder. Dr. Hampikian had just spent the weekend in a Montana cabin with Chris, a man he called a great guy and a teddy bear. And he spoke to us on November 6th, the day after he learned Chris had died in Las Vegas, shortly after he received nearly $12 million in a settlement with Idaho Falls and its police department. Well, then, the exact cause of Chris's death was unclear. All we knew was a head injury. Today, we learned Chris's death is now being investigated as a homicide by the Las Vegas Police Department. They began that investigation 3 weeks after Chris was found in a hotel room with head injuries. He died on November 5th after several days in a coma. And at the time, it was a suspicious death investigation after detectives learned Chris was involved in a fight with someone at that hotel. Clark County Coroner's Office ruled the 47-year-old's death a homicide as a result of blunt force trauma to the head. And as of now, no arrests have been made.
really stacked up in some places today, but right now we are offered a short break before a very busy 72 hours of weather. So in the meantime, be careful of the ice and the slush on the roads, and we will get mainly a break until tomorrow night before the snow really picks back up, but the mountains could see that a little bit earlier. But mainly we're talking about the Thursday to Saturday night time frame where things are going to be very busy. So you can see if we look forward in time to the modeled precipitation, our next big round of moisture is going to be mainly around tomorrow at late afternoon into the evening as more of this cold air and moisture combines as it moves south. Things really get going into the morning hours of Friday, and then will continue mainly until Saturday night. You can see again a lot of that moisture staying within our region, getting a little heavier at times in the overnight hours of Saturday, and then things get a little bit lighter on Sunday. But until then, we are talking about serious snow totals from that Thursday to Saturday timeframe. Yes, in some places in valley locations, a foot is entirely possible with the setup and consistency of what we're seeing. In the mountains, we're talking about multiple feet during this time frame. So specifically for the mountains, I know it's going to be really busy, so I want to break it down day by day. Tomorrow, we're looking at 3 to 6 inches in those mountain valleys. Ski areas will be higher. And then Friday, 8 to 16 inches. Saturday, 6 to 14. And then Sundays where we start to see those flurries. So very, very busy for us. But for tomorrow, things will be starting a little on the slower side for those Magic Valley spots. Again, 3 to 6 inches is what we're expecting for the mountain areas. And ski resorts will be higher, a little bit more favored for some of those higher totals towards the west central mountains, as some of that moisture will be mainly coming from the west. But in valley locations, we're talking about another inch tomorrow, mainly into the evening. A few areas could see up to 2 inches, but then Friday and Saturdays where we really start to see things pick up. And then past the snow, we have very cold temperatures to talk about. So we're getting a full blast of winter in the week ahead.
Well, a big blast of winter today, enough snow to shut down most schools in the area. Well, so we decided to go straight to the source and find out what the best part is of a snow day. And we get that answer from 2 of our guest reporters from the sledding hill at Camel's Back Park.
These are the best parts about snow days! Woo! Oh my gosh, that was so fun!
My name is Fisher, and I'm asking kids what they like about snow day. And this is my friend.
And I'm his assistant, Oakley.
Here, let's ask Henry. What's your favorite thing about snow day?
Just having fun in the snow and sledding and snowball fights.
Well, my favorite thing about snow day has been sliding down the hill and having new experiences and getting banged up a little.
And that sounds painful, being banged up.
Mom, can I go? Do you want me to go into the hospital today?
No, thankfully I think we avoided the hospital, but just barely. It was quite the wipeout you had.
I almost had to go into the hospital. Bye.
Luckily you didn't.
A lot of the snowmen, and well, this is my first time sledding, so sledding.
What was your favorite wipeout?
Probably the one that happened to me. Some kid just went straight under me.
What's your favorite thing about snow day, Ben? Okay.
This is probably the best snow day I've ever had.
I know.
Okay, right here,
I know, right?
Like, snowball fight.
All right, lots of comments sent in for this Wednesday. Let's get right to them. Bill likes what he heard about the changes to the JFAC process. Maybe it'll help getting a very thorough and complex analysis more efficient and timely. So he's in favor of that. When are Republicans going to stop trying to parent our children, asks Jim in Meridian, with regard to the harmful materials in library bill. Excuse me, but don't most libraries have a protocol for addressing questionable material already? Why are we trying to reinvent the wheel? Lord save us from those who want to save us, says Scott. And we did plan or want to talk to the Idaho Library Association. We reached out to them today. They're still kind of going over the details of this bill. Hopefully we hear from them tomorrow. When it comes to library books, if the parents are worried about their children reading something they feel is inappropriate, well, then they can go to the library and pick out books for their own children. This is from Kitty. There should be choices in books for everyone to choose from at the library. Dr. Cole, our medical director for Central District Health, a disregard for the truth, a healthy appetite for falsehood and conspiracy. I'm sure that makes Dave in Boise feel pretty good. And yes, Dr. Ryan Cole is still sitting on the board of the Central District Health, at least for the next 4 years or so, unless something changes. These are the things we won't know about with the Idaho Medical Board. They're not supposed to or even allowed to report any sort of discipline with doctors in the state, so we won't know unless, well, we find something out. We'll see tomorrow.